Be mindful of obtunded elderly patients brought to you after a fall from standing. You'll be surprised by the spectrum of life-threatening injuries they can suffer from seemingly innocuous falls, from thoracic and pelvic injuries to cervical spine fractures. Have a low threshold for investigating as appropriate. Intravenous calcium requires cardiac monitoring. Do not give if adjusted calcium is greater than 3 millimoles per liter or if the patient has digoxin toxicity. Consider an ultrasound assessment of the heart and lungs in any patient complaining of shortness of breath. In an unwell tachycardic tachypneic patient who is dropping their blood pressure before your eyes, think of and rule out 3 conditions first and foremost: tension pneumothorax, cardiac tamponade, and pulmonary embolism. Decision-making about the disposition of patients presenting with hematemesis must be guided by agreed risk stratification protocols. The quickest way to treat hyperkalemia is to give salbutamol. Other measures like calcium and insulin dextrose solutions will follow. Patients with severe metabolic acidosis may benefit from sodium bicarbonate. Confused elderly patients who are unable to express themselves may be in urinary retention. Run a bladder scan. Pulmonary embolism is a recognized cause of shortness of breath. It is worth risk assessing every patient who complains of breathing difficulty. Use Perk and Wells scoring systems where appropriate. A normal blood sugar, or pH, does not exclude ongoing or imminent diabetic ketoacidosis. Patients on the verge of DKA may initially compensate for metabolic acidosis by hyperventilation and may even become alkalotic. An unwell type 1 diabetic patient with raised ketones but a normal pH or blood sugar requires immediate DKA treatment. Children die of sepsis too. Do not allow the general reluctance to establish IV access and order blood tests in children to cloud your judgment. You can't wish sepsis away because it's inconvenient to get bloods. There is no quick turnaround for hyperkalemia patients. Those who are treated with insulin dextrose must be admitted for prolonged monitoring of their blood sugar and potassium levels. We encounter elevated ketone levels all the time. It's important to have an explanation for raised ketone levels every time.